We talked a little bit about capacity there. Thank you so much. Maybe let's move on to start to unpack the concept of complexity that's used in your research. And I'd like to maybe begin that exploration through the following quotation that I lifted from your research. So, quote, by better understanding this complexity, emergency managers and public health officials can implement more nuanced and encompassing social countermeasures aimed at preventing the unfair targeting of a specific ethnic group during this pandemic, end quote. Can you explain this statement for us?
Um, well, one of the things our research team noticed at the start, which was important, was that there was a primary narrative being established and recognized here in Canada that served to document instances of discrimination faced by Chinese Canadians. And there were numerous instances here in the greater Toronto area. There were instances in Vancouver and others where actual list and tracking projects were used to both document and count this growing problem in Canada. And I think that's important because it recognizes and documents the issue, but going beyond recognizing and documenting the issue, what our project is trying to do is move toward better understanding that relationship of complexity and capacity. An example of that would be one of the things that we found was in the first wave of COVID 19, there were stay at home even before the stay-at-home orders were in place, members of the Chinese Canadian community made decisions before there were any stay-at-home orders to stay at home. Some of those decisions made by the Chinese Canadian community were kind of misinterpreted as being based on something staying at home due to race-based stigma and perception due to the alternative of following public health protocols well in advance of when many of us were even thinking about those things. And I know Terry was able to talk directly to some of the persons who experienced those types of situations.
Yeah, for sure. We Lots of people, were telling us how they didn't think that a lot of the, for lack of a better term, show and tell from the politicians became helpful. When we had politicians come out to Chinese restaurants, the reality in many of these neighborhoods was that uh, the majority, probably upwards of 90% of the clientele, are Chinese. And they just took social distancing seriously before social distancing became a term. And they were fearful of catching the disease. As I said again, they had learned their lessons from SARS. Uh, many of these people are used to living in very, very dense spaces. It's Hong Kong, Taipei. They're very, very dense. And when they say there's a disease going around, people are used to staying at home. And to have that attributed to racism became somewhat unhelpful, because now when we have real incidences of racism, we run the risk of saying, well, why are you crying wolf? And so we have to be very careful, especially as we want to thank the politicians for having the hearts in the right place. We want to remind everyone that your language matters, what you say matters, and that perception, that long-term perception matters, because there could be more long-term damage than we realize when we say, well, you guys cried wolf last time. Why do we want to believe you this time? So we want that awareness to be there before we start putting labels on things. And unfortunately, many of these politicians probably don't care about that. It might have just been a photo op. But some of that damage certainly was done.
Because I think we see what when in the community, leaders and others attempt to deal with instances of discrimination, instances of racism, instances of stigma. Many are well meaning, trying to move society in the correct direction, to counter these, I guess, negative societal trends. But at the same time, it's easy to slip into treating a community as a homogeneous body, as a one size fits all, where
Mhm.
a simplistic view of the overall community is taken. And one of the things we're trying to show in our research is if we want to effectively counteract COVID based racism, stigma, or discrimination, it's important to understand a more complex view of the overall community, that it's not a homogeneous body of one size fits all. There's a range of experiences, there's a range of origins, a range of nationalities, and our research is trying to highlight some of those issues specifically within the Chinese Canadian community.